Seen and Heard: Ending the Isolation for Older Adults with Combined Vision and Hearing Impairment. This DVD is one of a number of resources developed by Senses Australia through the Ending the Isolation project. As people get older, it is common for them to experience deterioration of both their vision and hearing. This DVD provides information about the more common causes of vision and hearing impairment in later life, offering a greater understanding of the issues associated with a combined vision and hearing impairment and its impact on a person's day-to-day life.
Some of the issues that can be experienced living with a dual sensory loss can include things like breakdowns of relationships. If you can't hear properly and you can't see properly, it can be very challenging to try and maintain relationships with people, to maintain your inclusion in your community and in activities that have always been of interest to you in the past. Fatigue is very strongly connected to living with a dual sensory loss, having to concentrate extremely hard to make sure that you can access the information, and your world around you is very tiring. And often we find that people just give up and start to withdraw from their community. This can have a very negative impact on the individual and also on the relationships and the people in their lives.
Vision. There are many eye conditions affecting the older population, each with a different impact on visual function. Other factors such as changing light conditions, time of day, a person's health, medication and fatigue will affect functional abilities. Common causes of vision impairment affecting older people include cataract causing blurred vision, macular degeneration resulting in loss of central vision, glaucoma, which causes loss of peripheral vision, and diabetic retinopathy causing patchy vision. Charles-Bonnet syndrome does not cause vision impairment, but it is a condition affecting people with vision impairment, causing visual hallucinations that can be very distressing for those experiencing them. Processing or understanding visual information can also be affected by stroke, head injury, progressive neurological conditions such as motor neurone disease or dementia. Hearing. Hearing is affected differently depending on the type of hearing loss. Conductive hearing loss is caused by problems in the outer or middle ear. Common causes of conductive hearing losses are osteosclerosis, which is a growth around the bones in the middle ear, and otitis media, which is a middle ear infection and can cause permanent damage to hearing. Otitis media is a common cause of hearing loss in Aboriginal communities. Sensorineural hearing loss is a result of damage to the cochlea and/or the auditory nerve. Conditions causing sensorineural hearing loss in older people include Meniere's disease, which causes both progressive sensorineural hearing loss and balance disorders, and presbycusis, which causes progressive nerve deafness. Prolonged exposure to loud noise can also cause permanent sensorineural hearing loss. Tinnitus is the experience of ringing or buzzing in the ears or head, also having an effect on hearing. As with vision, processing or understanding auditory information can also be affected by stroke, brain injury, progressive neurological conditions, and dementia. Recognising the early signs of combined vision and hearing impairment.
As older people's vision and hearing deteriorate, some of the signs and symptoms can look a lot like dementia or cognitive impairment, so it's really important that older people have their vision and hearing tested regularly. Some of the signs and symptoms to look out for that might indicate a vision or hearing loss are the person might complain that people are talking too softly or mumbling. They might ask you to repeat yourself a lot more. They might start turning up the television or the radio to be able to hear it better. And with their vision, they might start needing to read near a window or turning up extra light to be able to see. They might complain of not being able to see faces or just being struggling to recognise people. They might start to withdraw from social situations because it's harder to recognise and hear what people are saying. And And they might start having more accidents because they're not seeing steps or objects around them. So they might look clumsy, but it can be just because of a vision impairment.
Other issues associated with ageing.
Two of the common effects of ageing are deteriorating vision and hearing, but there are a number of other effects of ageing or problematic issues that can arise with ageing that you need to consider also. Some of these include increased risk of stroke and increased risk of progressive neurological disorder, also hypertension, dementia, arthritis, and physical frailty.
Implications of combined vision and hearing loss. The psychosocial impact of combined vision and hearing impairment.
The onset of dual sensory loss presents some unique challenges. Without appropriate support and education, people can experience negative impacts on virtually every area of their life. Living with a dual sensory loss will impact on your communication, socialisation, mobility, independence, and isolation.
Communication. People with combined vision and hearing impairment will experience varying degrees of difficulty with communication. Even with a hearing aid or cochlear implant, an individual may still miss parts of conversations. Low vision impacts on communication, making lip reading and seeing facial expressions or body language difficult. Adapting the environment for better communication. Ensure light sources are behind the face of the person with dual sensory loss and shining on the face of the person they are speaking with. Minimise background noises by shutting doors and windows and turning off TVs and radios. Be aware of acoustics. Soft furnishings and carpeting will absorb sound, reducing echo and making it easier to hear. Approaching and interacting. Remember, the person may not know that you are there. Approach from the front or in their line of vision. Approaching from behind may startle the person. Say hello and say the person's name. Introduce yourself. For example, say, "Hi Joe, it's Mary." You may need to gain the person's attention by touching their arm or shoulder. Determine whether the person will be relying on vision or hearing or touch for communication. Establish which side is better for hearing at a comfortable distance for communication. Take into account lighting and minimise background noise. Keep your hands clear of your face. Speak a little slower than usual, maintaining rhythm of speech. Speak clearly without shouting, and allow time to process information. Repeat and rephrase. Remember, a person's nod or smile does not necessarily mean that they have understood you. Check the person has understood key information by asking them to repeat back the information to you. Prolonged concentration may cause fatigue. It may be necessary to stop for a break. Amplification and assistive listening devices should also be considered to optimise communication. Tactile communication methods may also be introduced. This is the block alphabet, which is used for print on palm. This is the deafblind alphabet. The block alphabet or the deafblind alphabet can be used to confirm spelling or in particularly noisy environments if the person is not able to hear speech at all. Accessing print. People with combined vision and hearing impairments will often experience difficulty accessing printed information. Options for accessing print include large print, use of magnification devices and applications, audio information including audiobooks, or having information read aloud. Getting around. Combined vision and hearing impairment can cause difficulties for a person to orient to their surroundings and move about safely. Many may prefer having a person to guide them when out and about. Guiding is a technique used when a person is new to an area or if they will have difficulty navigating independently. Let the person know you are there by offering your arm for guiding. Place the back of your hand against the person's hand so they can find your arm. Walk one step ahead of the person you are guiding. Adapting the environment. Ensure pathways are kept clear of clutter and obstacles for ease of physical access. Ensure high contrast on steps and other hazards. High contrast edging around doors and windows will also help a person with low vision to orient themselves. Top tips. Number 1, seek assistance. There are many strategies and increasing numbers of devices which can assist people with combined vision and hearing loss. Seek assistance from professionals skilled in working with people with sensory loss. Number 2, be patient. It is important to be aware that things will be slower and take longer for people with combined vision and hearing loss, so more time needs to be allowed. Number 3, make the effort. It is important to make the effort to support and encourage older people and persevere with difficult communication to support and foster the individual's sense of self and identity and to reduce isolation. Number 4, be creative. While many tasks become more difficult with a combined vision and hearing impairment, there can often be creative ways to get around these problems.
So how do we support people living with a dual sensory loss? We've highlighted many of the issues: the isolation, the mental health issues, depression, anxiety, the loss of self-esteem, the loss of identity, multiple issues that people that are living with this condition are having to deal with. We can help by appropriate referrals, particularly within counselling and mental health services, to help deal with the depression and the anxiety and the grief and loss that are associated with these conditions. Also appropriate referrals within the community, services that are going to be able to support people living with a dual sensory loss. Education for the community, for the families, for the carers and for service providers about how to appropriately support people who have a dual sensory loss and how to communicate more than anything and encourage that communication within that population so they are able to stay connected.
Patience, a sense of humour and a positive attitude will also go a long way to reduce the impact of a dual sensory impairment.